The purpose of this video is to show the insertion of a urinary catheter. The first thing you're going to do is to check the patient's order to make sure that we have an order for the insertion of a urinary catheter, and we do have that order. Then the next thing I'm going to do is, as I go into the room, I'm going to perform hand hygiene. And the next step will be to check the patient's identification. Good morning. I'm Elizabeth Powell. I'm going to be your nurse today. Can you tell me your full name, please? And your date of birth? Okay, thank you. Ms. Jones, your doctor has ordered that we insert a urinary catheter this morning. What that means is we're going to put a tube up into your bladder to allow your urine to flow out. And you've had one before? Very good. I'm going to go ahead and get things set up right now. But before I do that, could you tell me, do you have any allergies? And specifically, do you have any allergies to latex, to betadine, or to shellfish? Okay. The next thing we're going to do is we're going to perform pericare. Mrs. Jones, I'm going to just clean your private area prior to inserting the catheter. So I would do that, bring in a basin and a washcloth and clean that area. Now I'm going to go ahead and get my Foley tray, my kit that I'm going to use. I'm going to look at it and I'm going to make sure it has the items that I need. This has a 14 French catheter with a 5 milliliter syringe. Okay, so the next thing I'm going to do now is position the patient so that I have easy access. And I'm going to go ahead and just bring the covers up, and I'm going to ask the patient to slightly bend each of their legs and separate them so I have room to put my kit when I'm ready to insert the catheter. Okay, now I'm going to go ahead and get my kit ready. And you'll notice on one side of your bag you will have an area that says peeled to open. And I'm going to try to peel this open. And I'm just going to peel that open. I have a trash can here, and I'm going to dispose of my trash. I'm going to take out and put that to the side also. And then I'm going to use this small plastic bag as my trash bag for when I am disposing of some of my supplies. And I'm going to put that slightly on the bed, just to the side. Now I'm going to come back to my kit, and at this point I'm going to be opening up my kit. Again, you'll notice that on the bottom of the kit it's slightly taped, so I'm going to remove the tape. And then, following sterile technique, I'm going to go away from me in opening the kit. I'm going to open it side to side. And as I do that, I'm going to try to kind of straighten out. And then I'm going to come this way. Now this is actually, I'm going to take this, put that. Nope, sorry. All right, now I've kind of gotten mine. At this point in time, now I'm going to put the sterile drape down, and I'm going to take the edge of the drape, which is a little hard to find. Here we go. And I see I'm holding it up, and I'm going to come away and gently open up the drape. And I'm just going to touch the very edges of the drape because if you remember, the 2 inches are considered non-sterile. I'm going to put the shiny side down, and I'm just going to very gently lay that and let it drop. At this point now, I'm going to put on my sterile gloves because everything in the kit is sterile. So I'm going to pick up my gloves, and I'm going to come to the side to put my gloves on. And I'm going to open my gloves carefully without touching my sterile field. All right, now I'm going to lift up my right-handed glove, and again up over my field. Okay, and if you have problems, we're just going to have to leave that until we get our second glove on. Now I'm going to get my second glove on. All right, now at this point I can come back and kind of fix my gloves because I had two fingers in one. Same thing over here. Remember the principle, sterile to sterile. So I can touch it because both of my gloves are sterile. Now I'm going to get my gloves positioned and I'm good to go. Now I can touch anything in my kit. So I'm going to move my kit, just kind of square it off. And now I'm going to see what I have. One of the other things you'll have inside your kit is this called another drape. And for right now, we don't need to use that, so I'm just going to drop that to the side. What I see now in my kit is I have some swabs, povidone iodine swabs. I have a lubricating jelly. I have some cotton balls and forceps. I also have a syringe that contains sterile water. All right, so at this point I'm going to go ahead and get everything ready. I'm going to very carefully go ahead and remove the sheath from the catheter tubing itself. Okay, now I'm going to go ahead and take the syringe and I'm going to connect it to the catheter itself. And then I'm going to put that back inside my case. I'm going to take my lubricating jelly at this point and I'm going to squeeze it into the top plastic container. I'm going to get rid of that. I'm going to open up my iodine solution. Now, because we're doing this on the mannequins, we're not going to have you actually use the iodine solution itself. So we're going to pretend you're going to take the iodine solution, pretend that you're pouring it over your cotton balls, and then discard it. So now I've done everything in preparation. I'm going to go ahead and bring the box to the bedside to complete the procedure. So again, I'm going to put the plastic tray on top. I'm going to carefully lift the box by the side here, and I'm going to place it on my sterile field. Okay. At this point in time, I'm going to now touch the labia with my left hand. So now my left hand will no longer be sterile and I'll be working with just one hand. So I'm going to open up the labia with my fingers. I'm going to take my cotton balls with the tweezer, which are now saturated with iodine. I'm going to wipe once and discard, wipe again and discard, wipe a third time and discard. And I can get rid of that also. I'm going to take my tray and move it out of my way. And now I'm going to take my catheter and I'm going to lubricate my catheter and I'm going to open up so I can see the urinary meatus. And I'm going to very gently insert. Sometimes with the mannequin you might have a little resistance. Okay, I'm going to continue to insert until I see flashback, which would be I see urine now in the tube itself. Okay, I see flashback. I am going to come down and hold the catheter as after flashback, I'm going to insert it 2 more inches. Now I'm going to go ahead and hold the catheter and insert the sterile water to blow up the balloon, which is now inside the bladder. Once it's completely inserted, I'm going to release my hand, remove the syringe, and then tug very gently on the tubing to make sure that it's in place. And I would then once I tugged, I can go ahead and just push it back in just a tiny bit more. And now we have the completion of the insertion of the urinary catheter. I'll take the catheter bag and I will drape it to the side. And there should be usually a little hook that you can hook it to. You can also attach this little piece to the bedding. And then I would also get a cath secure to actually then attach it to the patient's inner thigh. The last thing I would do once is to get the patient back into a comfortable position. Make sure I discard all of my supplies appropriately. Get the patient covered up again. Bed in the low position, call bell within reach. And then I would go out and I would document in the computer that I had completed the procedure.